My name is Jessica Barch, and I'm the Community Program Manager of the Greater Illinois Chapter. For those of you who are new to the Foundation, we welcome you. And for those of you who are joining us again, welcome back. We're so happy to have all of you here with us today. Before we get started, I wanted to share some information with you. The Parkinson's Foundation has wonderful free resources. We have educational books, a podcast, a wonderful helpline staffed by experts, our website, parkinson.org, and more. And there are two I'd like to highlight today. One is our Nutrition and PD fact sheet, which is one of many fact sheets available to download online, as well as one of our many publications, our book, Speech and Swallowing, which is a topic that will also be discussed today. I also want to share some exciting information about our national initiative, PD Generation. Did you know the Foundation is offering genetic testing at no cost to people with Parkinson's disease? Participation can either be in person at one of our participating centers of excellence or now from the comfort of your own home through a telemedicine appointment and an at-home cheek swab collection kit. To learn more, visit parkinson.org/PD Generation. Lastly, I wanted to let you know about our upcoming program, Wellness in PD, exploring exercise, music, and art to cope with PD. To learn more or register, visit parkinson.org/Illinois Wellness. And as always, don't forget about our wonderful PD Health at Home virtual series, where we focus every Monday, Wednesday, and Friday on mindfulness, wellness, and fitness. To learn more or register for these programs, please visit parkinson.org/PD Health. And now it's my pleasure to introduce our first speaker today, Erica Fenton. Erica believes in the crucial partnership between patients and therapists in order to achieve and maintain success. Erica provides treatment and management in the areas of swallowing, voice, speech, language, cognition, and augmentative and alternative communication. She works at the Neuro Movement Disorders Clinic at Central DuPage Hospital, Northwestern Medicine, and also maintains a position as an adjunct professor for the Allied Health and Communication Disorders Graduate School at Northern Illinois University. Erica has achieved special certifications for the treatment of patients with movement disorders and leads the Parkinson's program at Central DuPage. Thank you so much for joining us today, Erica. We're so happy to have you.
Thank you, Jessica. Hello, everybody. Good morning. So as Jessica was saying, my name is Erica Fenton. I'm a speech language pathologist. I graduated with a master's degree from Rush University and went on to complete my fellowship at Hines, VA. I've worked for Northwestern Medicine at CDH for a little over 8 years. And I also teach for the graduate department at Northern Illinois University. I teach their swallowing and swallowing disorders course. So today we're going to talk about swallowing and swallowing disorders as they relate to Parkinson's disease, as this is an important piece in being able to maintain nutrition and hydration over time. So these are some of our objectives for this morning. So we're going to define dysphagia and discuss the clinical signs and symptoms of aspiration. We're going to look at understanding Parkinson's related changes in swallowing, smell, utensil holding, and their impact on nutrition as well. We're going to discuss the importance of exercising the muscles that control swallowing, and we're going to discuss some current programs and techniques that address voice and swallowing changes. So we're going to start with a little poll this morning. I want you guys to go ahead and answer this for us. What foods are you most looking forward to this holiday season? You can feel free to select one or more than one of these options. I'll give you guys a little time to respond.
Yeah, but well, I was going to say,
I'm not seeing poll responses coming in. Are you guys seeing those? Oh, there we go. Okay, wonderful. Turkey. Everybody seems to be excited about turkey. I agree. That's always a fun one. Not a lot of ham families here, though. And stuffing seems to be our other option that was really highly rated. Man, I thought dessert would be higher up there. That might be one of mine. We know that the holidays are a special time for many of us. We often kind of gather around the table with loved ones to share traditional family dishes, celebrate and connect with one another. If you think about the holidays, reunions, birthdays, weddings, any sort of celebration, really, nearly all these celebratory events have at the center some sort of food or drink. We often share love through food, and eating and swallowing is highly important to maintain nutrition and hydration, but it also serves as a form of connection for us with friends and family. So together we're going to discuss swallowing as it relates to Parkinson's and how we can maintain these skills over time, which is an important way to make sure we can continue to participate in those activities centered around food that connect us so much together. Okay. So first we're going to talk about normal swallowing, because we need to understand kind of normal before we can talk about how Parkinson's can impact the swallow. So when you think about a normal swallow, there's actually a lot that occurs that we often don't think about, because we've been doing this our whole lives, kind of eating and drinking, and it happens largely automatically. So we don't really think about all of the steps and phases of the swallow. So there are really three phases to the swallow: oral phase, pharyngeal phase, so the mouth and then the throat, and then esophageal phase. So the phase as it kind of moves down into the stomach and the digestive system. Swallowing is controlled by a series of valves and chambers, and it is sort of a pressure acted upon the food that moves that food through the system and down into the stomach. So first we have oral accepting things into the mouth. We seal the lips. Mastication refers to chewing. So we chew the food up, kind of mix it with saliva and get it prepared to swallow. There's sort of a rotary and lateral tongue movement that moves the material on and off to the grinding surfaces of the molars. There's anterior bulging of the soft palate to keep material from going out the nose, although if we laugh or talk, sometimes that doesn't work so well for us. The tongue has a posterior movement to push that food or bolus back into the throat or pharynx. We trigger the pharyngeal swallow. You'll see closing of the velopharyngeal system, closing of the larynx. Hyolaryngeal elevation, which is elevating the larynx, kind of moves up and forward to protect the airway closure and protection. And then pharyngeal stripping is clearing the material from the throat. So sometimes we see a nice clear pattern, and sometimes things can be left behind. And then opening of the upper esophageal sphincter to allow the foods and liquids into the esophagus. There's esophageal peristalsis to move that material towards the stomach. Now, obviously that's a whole lot of information. There are several essential body parts involved in swallowing. In addition to the things we talked about here, the brain, the respiratory system, functional head and neck anatomy, and functional laryngeal valving or closing of the airway is necessary to have a normal swallow. We need adequate coordination of the oropharyngeal muscles in order to get appropriate ability to sort of pause the respiration long enough to successfully complete the pharyngeal swallow. We're going to actually take a look at a video here, because I think it's really important to kind of see that in moving fashion. I can say all this stuff, but I think it's really a little bit more impactful as we see that happen. So we're going to go ahead and look at a video here. Okay. Here we go. So this video talks about normal swallowing. So you can see this goes really quickly. So that's a normal swallow. We're going to break that down, slow it down a little bit, and walk through some of the moving parts. So here you're looking at a cutaway of the head. The first valve of the swallow is the lips. We're going to take that material into the mouth, kind of cradle it between the tongue and the upper border would be the hard palate and the soft palate. So you'll see this liquid being taken into the mouth, held on the tongue. As we get ready, we're going to push that material back into the throat. You see this nice wave-like motion of the tongue as the soft palate moves up to protect the material from coming out through the nose. And then we begin to push that material back into the throat. Before we do that, we do want to see nice airway closure. So the airway is highlighted here and labeled voice box. That's the larynx. The larynx has 3 valves, the true and false vocal folds, as well as the epiglottis. Those 3 valves close from bottom up to protect and seal off the airway as that material passes by. So you can see there that airway is closed off nicely here. So the vocal folds, which are those sort of white lines that you see, are closed, and then the epiglottis flips over the top sort of as like a cap as the material goes down into the upper esophageal sphincter, which we'll highlight in just a moment in blue as well. So you see that nice laryngeal valving or closure of the airway, and none of this material enters into the airway as we swallow down into the esophagus or the food tube. The opening of the esophagus or the food tube is called the upper esophageal sphincter, and you can see there it's pulled open by that hyolaryngeal elevation. So that's in a normal circumstance. I'm going to switch back over to our PowerPoint here. Okay. Come on. So, sorry, let me get to the next slide. There we go. So the video we were just looking at is normal swallow. If the swallow begins to break down, then we can see a variety of different issues. We typically refer to any swallowing problems related to safety or difficulty or discomfort as dysphagia. You can see the spelling of it at the top of the slide here and the pronunciation dysphagia. There are a variety of different causes. Causes can include things like stroke, brain injury, head and neck cancers, diseases such as Parkinson's. There are a variety of different ways that swallowing impairments can occur, even just aging. As we know, our muscles change over time. So if the muscles become weaker, that can result in impaired swallowing as well. Symptoms can include things like coughing, choking, aspiration, which means foods or liquids entering into the airway, extra time required for meals, pneumonia can be a red flag for us. That's certainly concerning. Weight loss, sensations of foods or liquids sticking in the throat, just to name a few. There are some other ones that I might mention would include things like watering eyes, sneezing. There are a variety. If you feel like anything is abnormal with your swallow, we would want you to report that to your neuromovement disorder specialist so that they can determine if a referral to speech pathology is warranted. Clinical signs of aspiration, there are typically 3 big ones that we consider, but as I said, there are a variety of different things that can be signs of dysphagia, but coughing, throat clearing, or wet or changed vocal quality during meal times are some of our big factors that can be signs of aspiration. If any of this stuff is occurring, evaluation and treatment by a speech language pathologist is crucial for concerns for swallowing. One important thing to think about with Parkinson's is that sometimes these symptoms can be a little bit more subtle, and we're going to get into that in one of the future slides as well. Okay, so if you get a referral to a speech language pathologist, what might they do with you? So the first step would be assessment. So your initial session, they're going to be evaluating your swallow function and determining what the best next steps would be. We have a variety of different assessment methods, which can be warranted depending on the specific needs of the patient. So the first one at the top here is a video fluoroscopic swallow study, also known as a modified barium swallow. You'll hear this referred to as different names, just dependent on like regions of the country. And some people call it a video or a cookie swallow. You'll hear it abbreviated VFSS or MBS. That is the image that's at the top there, where it's the X-ray image kind of the, looks like a cutaway of the head. The 3D image is sort of collapsed on top of itself, and we can assess for oral, pharyngeal, and esophageal swallowing by using a video X-ray. The patient is provided with a barium contrast, which is that dark material that you see in the mouth there. And we can watch where that goes as the patient swallows, and we can assess the physiology of the swallow to determine what is causing the impairment and then assign the appropriate treatment. Fiber optic endoscopic evaluation of swallowing, also abbreviated FEES, is the one that's on the bottom there. So this is a little camera inserted in the nose and angled down to look at the larynx. So you get an assessment of the pharyngeal swallow with a color, it's a high quality video where we can see color, we can assess the tissues themselves, and then the food that's provided to the patient is dyed blue, which you can see on the right there. And we can assess, again, the physiology of the swallow and determine what the best course of treatment may be. A clinical swallowing evaluation is a evaluation with the speech language pathologist. The first two are imaging evaluations. A clinical swallowing evaluation is not an imaging evaluation, but it is a critical tool in the assessment of the swallow. Typically, we see that the clinical evaluation of swallowing is done first with the appropriate imaging evaluation assigned by the speech language pathologist. In certain cases, if there's been, pneumonia or high risk, you may go right to the imaging evaluation and have the clinical evaluation with your speech therapist before initiating your treatment. Manometry is another form of assessment that we can also do. This one is not quite as common as the first two that we mentioned there. Manometry assesses pressures. So if there's a concern and need to assess pressures within the system, as I mentioned, it's sort of a series of valves and chambers operated where the food is operated on by certain pressures to clear it through the system. If we need to assess pressure, then we use manometry. Okay, so I mentioned one of the concerns with dysphagia is aspiration. This would be food, liquid, saliva, or stomach contents entering into the airway. Risks for aspiration is a risk for anyone that has dysphagia. If foods or liquids are going into the airway, we can see concern for pneumonia, and we really want to make sure that we assess that and get appropriate treatment going. In patients with Parkinson's, there's a little bit of increased risk because that aspiration can be silent, meaning if I were to swallow wrong right now, we've all had this happen, something goes down the wrong tube, I would have a cough response, right? We would typically know that experience, but with Parkinson's disease, actually that sensation of aspiration can be influenced and we can see silent aspiration. So it's not uncommon that voluntary cough can be stronger than the reflexive cough. So we may be able to actually produce like a good voluntary cough, but if there's a swallowing impairment where small amounts of foods and liquids are going into the airway, that reflexive cough may not be quite as protective. We know that about a third or 33% of individuals who aspirate will do so silently. So that's, high enough of a concern that we always like to implement those imaging evaluations that I mentioned, because we can miss that aspiration about a third of the time because it could be silent or have no outward signs. Aspiration pneumonia is the leading cause of death in end-stage brain disease. In the general population, aspiration pneumonia is the fifth leading cause of death for individuals under the age of 65 and the third leading cause of death for individuals under the age of 85. So even in absence of neurological disease, we know that this is a concern for us as we age. And compounding that with the risk for silent aspiration means that it's something that we need to be aware of and treat appropriately in patients with Parkinson's disease. So if we want to think about what does a good cough look like, I always like to teach this to people because it can be helpful to kind of train a good cough. We all know that coughs can happen sort of reflexively, but if we need to cough, we can do so in a way that can sort of protect and preserve the vocal folds, which are very delicate little tissues, the valves within the larynx that we saw in the first video. So I want you guys to just do this with me. You're going to take a deep breath, completely fill your lungs up with air. Really think about breathing into the belly and breathing into the diaphragm. Okay, so nice deep breath, 2 coughs, and a swallow. So that breath acts as sort of a pillow for those vocal folds. As we cough, we kind of slam the vocal folds together. If we cough the wrong way, we can create a little bit of irritation and trauma on those vocal folds, which can create swelling and injury over time. But a cough is an important protective mechanism. So if we do have to cough, think about breathing in deep into the belly, 2 coughs, and a swallow, because if we cough that material out of the airway, we want to swallow it down the right way. Otherwise, it's sort of like a slip and slide. It can fall right back into that airway and kind of come from where it came. We know that increased risk for aspiration occurs with poor oral care and dependence on others for oral care. So keeping your mouth clean is actually a very important factor in reducing aspiration pneumonia. Reduced mobility and being bedbound is another increased risk for aspiration and pneumonia. So if you are up and mobile, we have a little bit more ability to sort of fight the pneumonia versus being more bedbound. The risks sort of are a little bit higher. Reduced independence with feeding is another complicating factor here, and then a compromised respiratory system. If there are additional respiratory concerns, we may have increased risk and severity of aspiration and pneumonia. I want to show you guys another video here, and we're going to take a look at a similar video that shows us actually this time some disorder. So I'm going to stop sharing and just switch over to that video page again. Oh, sorry. Okay, let's go back. Sorry, excuse my moving around through this site. Here we go. All right, so now we're going to see some of that material actually entering the airway, so you can get an idea of what this actually looks like. So you can see that small amount of material entering the airway as the patient swallows. So they're going to go over some of the normal swallow again. So that's our good airway closure, where we'd be protecting the airway and pushing all the foods and liquids down into the proper tube. These tubes sit directly next to each other. One in the airway's in front and the food tube is just behind, between the airway and the spine. So they're very close in proximity. So the likelihood that something could go down the wrong way is, more significant just because of the way our anatomy is laid out. We've all had that experience where something went down the wrong way, and the reason is because of the way we're oriented. So here we see the two airways, and you see that small amount of material entering into the airway instead of going down into the upper esophageal sphincter and esophagus. So even small amounts of material going into the airway are risk factors for pneumonia. So we do want to be cautious. And if we see any red flags or warning signs, the sooner we get treatment and address those concerns, the better off we will be. Okay, so I'm going to stop sharing that one and just go back over to our slides here. Okay, there we go. All right, so now let's talk specifically about Parkinson's. So we know from research that up to 50% of individuals with Parkinson's disease will experience dysphagia of some degree. This may increase to as much as 90% of individuals with Parkinson's as the disease progresses. Okay. Dysphagia symptoms in Parkinson's are listed here: coughing, throat clearing, changes in voice, as we discussed. Globus sensation means a sensation like something's always sticking in the throat. You may feel like you need to swallow several times to clear things down, especially with thick, sticky, or dry foods. Difficulty swallowing pills, feeling like they always get stuck as well. Drooling, extra time required for eating and drinking, a dry mouth. So we have kind of the opposites, drooling and dry mouth there. Reduced intake of fluids and foods, and a reduced comfort with eating and drinking, reduced awareness of swallowing problems, weight loss, and fever. Fever would be a warning sign that there could be pneumonias going on. It's helpful for loved ones to kind of understand these symptoms as well, because in Parkinson's disease, there is what we refer to as a perceptual mismatch. So the way it feels to me might be different from how the actual process of swallowing is occurring. So it might feel normal, and in reality, there could be some dysphagia going on, and that's just a fact of the Parkinson's disease. And that's well documented, and we do see that really frequently when working with patients with Parkinson's disease and dysphagia. So if someone doesn't notice themselves, but you notice some concerns, it might be important to kind of discuss those things. Some patients are able to kind of pick up on these things on their own, and we have some tools, we're going to see that on the next slide, to help assess your own swallow function too, to see if you have any of the warning signs or concerns that we might want to get you hooked up with a speech language pathologist. It can also be helpful for loved ones to offer liquids more often and keep liquids readily available. The concern is keeping good hydration. So we know that all individuals can have a little bit of concern with dehydration, and this is Americans are sort of chronically dehydrated. So just the act of offering might encourage better hydration and more intake of liquids. Not only does continuing to keep your hydration at the right level help with overall body systems, and also help to keep the strength of your swallow and maintain it over time, because swallowing is good exercise for swallowing. But we also know that medications are titrated to a hydrated system. So across the board, you can really get a good benefit by making sure you maintain your hydration. And just little reminders from friends and family can be really beneficial, or even one of those water bottles that lights up when you're supposed to drink. We've got lots of tools like that in our society now, which is nice. But we do want to make sure we try to reduce dehydration. We swallow about 2 times a minute and only about 2 times an hour while we're sleeping. So that's interesting to know. Parkinson's can actually influence automatic behaviors overall. And so the frequency of the habitual swallow may be impacted. That's why we see drooling, and sometimes we can see those changes in posture associated with Parkinson's. So that kind of anterior tilt can allow material to spill out of the mouth. Dry mouth, though, can also be a concern, as many medications can contribute to dry mouth too. So I want you guys to think about making sure that you're swallowing frequently, okay? All of us should really do this, no matter who we are or what different diagnoses we have. Swallowing hard and fast, keeping the swallow mechanism moving, and actively using that on a regular basis is going to help maintain our muscles. We know that if we maintain activity with the rest of our body, that we are able to kind of keep ourselves strong. The same principle applies for the swallow. So you think about that old adage, use it or lose it. I like to kind of think about that more positively, use it to improve it, okay? So we're going to take a peek at the next slide. This is a screening form that we use. This is called the 810. It's a form that you can fill out, and you guys can feel free to print this out and fill it out for yourself, and kind of circle your severity on each of these from a range of 0 to 4. So if you score greater than a 3, we may in fact have some swallowing problems, and it may be warranted to kind of discuss that with your doctor and see if speech language pathology referral would be appropriate. Because of the perceptual mismatch with Parkinson's disease, this can really be a valuable tool to help discuss swallowing and determine if therapy is warranted. You may see this in some paperwork and things at your neurology office, or if you're going in for a speech language evaluation for voice. A lot of times we include this to sort of screen to see if swallowing impairment could be an issue as well. Okay. So we mentioned the phases of the swallowing: oral, pharyngeal, and esophageal phases. These are some oral stage difficulties that we can see with individuals with Parkinson's. Changes in taste and smell often occur early on. Drooling and dry mouth, as I mentioned, a tongue tremor, disturbed lingual peristalsis, meaning that movement of the material from the front to the back of the mouth might not be quite as organized and smooth. Slowed oral transit time, tongue pumping action, and sort of a pill rolling movement of the tongue. So kind of trying to get it back, and kind of kicking it back and forth in the mouth. We can assess that very well in the video swallow study and train more of a volitional swallow to address that. We also can see difficulty with bolus formation. Changes with taste and smell are an important one. That one occurs early on, and a lot of times this can make foods and liquids a little bit less appealing, and therefore it can impact intake. Remembering weight loss is our enemy, we want to make sure that we are achieving adequate intake to maintain our weight and adequate nutrition and hydration, which is really why we're all here today to discuss. Dysphagia can occur at any of the phases of the swallow, so we can help in any of those areas. Oral phase difficulties can be related to rigidity of the lingual musculature. Parkinson's is a movement disorder, so it's important to understand that the movement is the issue. A lot of times people think that weakness is the challenge. Well, it's really the changes in movement over time that can contribute to the weakness. But if we capture the movement and do the right exercise and therapy, we can really maintain the strength, which is a wonderful silver lining. The pill rolling and tongue pumping, that rocking and rolling movement of the tongue, is another one of the most common symptoms. So you may kind of pick up with that and relate to that. And then reduced tongue-based retraction is another common symptom that's reported, which can result in difficulty kind of clearing the throat out, and feels like things don't always go down. So we often see patients come in reporting that it's solid foods that they have trouble with because they feel like they're always getting stuck. That can progress over time. So if you're noticing anything like that, the sooner we get you the appropriate exercise program, you can continue those things at home. So it's not necessarily long-term treatment with a speech language pathologist. It's really more episodic care where we teach you what to do and then we say, okay, go do it. And then we're here to support you as you need. The next slide has some additional oral stage difficulties: hesitancy initiating the swallow, repetitive anterior-posterior rocking pattern, prolonged ramp-like posture of the tongue. So kind of that freezing can occur with the tongue as well. Piecemeal deglutition means swallowing in very small bits. So kind of breaking off a little piece and swallowing instead of swallowing the bite all at once. The bolus or food falling over the base of the tongue into the throat before we're prepared for it. Reflux from the base of the tongue back into the mouth, increased mastication time, meaning increased time to chew and prepare the foods for swallowing, and then limited mandibular movement, limited movement of the jaw. Swallowing can often be delayed due to contractions of the striated muscles of the pharynx, which is under control of the lower brainstem. Swallowing is a patterned response, and so it occurs sort of as more of an automatic movement. And those automatic movements are more impacted in Parkinson's than the volitional movements. There are two tracts within the brain, the pyramidal and the extrapyramidal system. We often refer to those as the direct and indirect pathway as well. Automatic movements live in that indirect pathway, and that's more impacted by dopamine. There's more dopamine required to use that system, and so it's more impacted with individuals with Parkinson's. If we move the swallow more into that intentional system or that direct system, we can have a little bit better function. And this carries over to speech as well. And we'll touch on that a little bit today too. Okay, let's talk about the throat. So pharyngeal stage dysphasias in Parkinson's can have a moderate delay in the swallow. The response kind of triggered at the point of the vallecula, which is a little bit deeper than we like to see into the throat. Reduced pharyngeal peristalsis, coating of the pharynx and kind of residue, decreased relaxation of the pharynx after the swallow. Aspiration can occur before, during, or after the swallow. So remember, that's that material entering into the airway. Pooling in the vallecula or piriform sinuses, which are some pockets that exist normally in our anatomy, but they can sort of hold on to things if we're not stripping the pharynx completely. Incomplete laryngeal closure, decreased laryngeal elevation, and then cricopharyngeal spasm. So all of these things can result in material either going into the airway or pooling in the throat or spilling into the airway after the swallow. One thing to note is that a speech language pathologist is responsible for the oral and pharyngeal phases of the swallow. Esophageal dysfunction is managed by GI, but we can touch on strategies for those things as well. And then it's also important to know that delayed pharyngeal swallow is one of the most common characteristics for pharyngeal swallowing in individuals with Parkinson's. So if you feel like it's a little harder to get that swallow going, that would be, fairly consistent. All right, let's talk about the esophageal stage. So these are some of the concerns you can see: reduced esophageal motility, gastroesophageal reflux disease known as GERD, non-motor GI symptoms, and webs and strictures. And for these things, we would typically have you see a GI doctor. Although we can also recommend some strategies, things like smaller, more frequent meals, eating more slowly, small bites and sips, remaining upright for about 30 minutes following meals, and increasing that to about 2 hours prior to bedtime. You really got to do your planning in order to do that though. So make sure you know when your bedtime is and kind of back up 2 hours for your last meal. Sleeping at a 45-degree angle, and then avoiding tight belts and waistbands. Fortunately, we're all wearing our athleisure gear nowadays, so that's usually a little bit less of an issue. But if you are kind of feeling constricted, that can contribute to difficulties with swallowing. So I mentioned this earlier in the program, but I want to highlight it and make sure that we're really well aware of this. Oral care is the most significant factor in reducing risk of aspiration pneumonia. We have really good research to support this. We want to brush the teeth to clean them. Okay, so even if we have dentures, we want to brush the dentures before we put them in the little bubbly water. Brush the teeth, all surfaces of the mouth, roof of the mouth, tongue, cheeks, everything. We really want to brush to break up the bacteria colonies, because that bacteria that lives in all of our mouths, we could swab everybody in here right now, we all have it. No matter how clean we keep our mouths, that bacteria kind of builds up, and the brushing helps to break up those bacteria colonies to make sure that there's less risk of it washing down into the lungs, which is a known cause of aspiration pneumonia. So I always say brush as frequently as possible, because increasing your oral care by at least one occurrence a day can actually reduce aspiration pneumonia risks by as much as 50%. So that's a huge factor. So we always like to discuss oral care and make sure that we're being as aggressive as we can be with cleaning that mouth. And it's not just brushing the teeth, really think of it as cleaning the mouth. Saliva substitutes can be beneficial too if you are feeling like you have difficulties with the dry mouth, which is common for individuals with Parkinson's and really anybody with that polypharmacy. The more medications you're taking, the more likelihood that we see that dry mouth. But you can use rinses like Biotin to kind of help with that. It's really more of a preventative treatment, so you want to make sure you keep up with that regimen. So what does treatment look like? There's really two arms to this. There's a compensatory arm and a rehabilitative arm. So compensatory things can be like coordinating eating with the cycle of medication. Make sure you're eating when you're feeling your best. That's going to reduce the risks of dysphagia. Swallowing strategies, which would be assigned to you by the speech language pathologist following your imaging evaluation. Training a volitional swallow. So swallow hard and fast, swallow with intent, swallow like you mean it. So I always like to kind of demonstrate this to people. So if we swallow normally, you can see there's a little bit of movement in that throat. We can also swallow like a nice hearty volitional swallow. So swallow with intent, and you'll see the difference here. So you can see more activation of those muscles, more squeeze in the pharynx, a much better, stronger swallow. So swallow like you mean it. Smaller, more frequent and highly nutritious meals, modifying utensils or cups, and then modifying consistencies if need be as well. We can implement thickened liquids, softer or pureed foods, or supplementary nutrition. So we want to have that compensatory approach so that we can address concerns and make sure you're getting good nutrition and hydration. We also want to look at a rehabilitative approach to maintain this function over time, because as we know, Parkinson's is progressive and degenerative. So the more we can work on maintaining function, the better our function is going to be 10, 15 years down the line. The McNeil Dysphagia Therapy Program works on a volitional swallow, effortful swallow, and that can be a really great way to target teaching a patient how to use this volitional swallow. Traditional swallow therapy, and that would be exercises assigned by your speech language pathologist based on your specific physiological needs. And then the IOP can work on tongue strength and oral strength as well. It's a little balloon that goes into the mouth, and you kind of push and can measure the strength of the swallow. But always think about swallowing hard and fast. We should really all do this. It's exercise for the swallow, just like, moving your body with intent, like LSVT big and those sorts of things. We want to move the muscles of the swallow with intent. Okay, so a little plug for treatment here. So in addition to swallow therapy, voice therapy can be exceptionally beneficial for individuals with Parkinson's disease. We always like to get patients involved in treatment and a home exercise program as early as possible. I would love to see you on the day of your diagnosis or as soon as possible, because we can teach you things that you can do in order to keep yourself really strong. So some of these ones that have really good validity in research are Speak Out, LSVT, which is the Lee Silverman voice treatment. Expiratory muscle strength trainers is a little device that you kind of blow into to keep the respiratory system very strong, because again, respiration is a automatic movement. We can kind of train those muscles and practice in a volitional environment to keep things strong. Vocal hygiene, so keeping that voice nice and healthy. These include things like making sure we're staying well hydrated, not having a cough that's going to be disruptive or damaging to the vocal folds. So that good cough that we practiced before. And there's a whole slew of these that your therapist can assign to you. And then sing out. We know that singing is a really great exercise for individuals with Parkinson's. You can either do this on your own, or there's really great organized programs. One of them is called Sing Out. You can get involved with these things in your community. CDH has some wonderful groups where we practice these things. So you would go through your individual therapy with a speech language pathologist, and then you kind of get rolled into this free group therapy that helps with maintenance. So we have what we call the Loud Crowd, which is the exercise program associated with Speak Out that helps maintenance over time, and then also Sing Out. And you can do both of them, and they're free of charge. Right now they're paused because of COVID, but we will be going back to them. Exercise and therapy overall. So plug for my PT and OT friends here. LSVT Big is a stellar program with a ton of research. It really helps to maintain function over time. And remember, when we're talking about Parkinson's, maintenance is the name of the game. Rock Steady Boxing is a fantastic program as well. I think they're even doing some things online now, which is excellent. So you can keep up with those things even during the pandemic. And then forced exercise. Any form of forced exercise has been shown to really help maintaining skills over time. Okay, so I mentioned vocal hygiene. Here are a variety of different vocal hygiene techniques that you can start implementing today. So just quickly to go through those ones. Increasing the amount of water that you're taking to either 64 ounces or half your body weight of water. You can clear that with your doctor. Increasing humidity to 35 to 50% relative humidity is very good for the health of the vocal folds, and the voice and the swallow are controlled by the same anatomy. It's all the larynx. So by keeping the vocal folds healthy, we're keeping not only our voice healthy, but the swallow healthy as well. So 2 birds with 1 stone. Steaming, kind of inhaling some nice steamy vapor, can be really beneficial to keep that vocal system nice and moist. A nasal breathing pattern is preferred over an oral breathing pattern. Nasal saline drops can be beneficial. Avoiding the use of cough drops as well. These things are drying. A lot of time people think, well, I've got this like throat clear cough, I should continue to use these cough drops. It almost perpetuates the cycle. So we can teach you better ways to manage that. Avoid drying substances and behaviors like alcohol, caffeine, smoking, and vaping, and then keep reflux in control. All these things are going to keep that larynx healthy, which is going to help to keep not only the voice healthy, but also the swallow. All right, so in summary, monitor for any clinical signs of aspiration, coughing, throat clearing, changes in voice, anything that feels unusual during meals you want to try to pick up on, and make sure you're relating those things to your neuromovement disorder specialist. They're really great at kind of helping determine what would be appropriate if you need a referral, or if this can be managed. Swallowing hard and fast. Use that effortful swallow like you mean it, and then speak with intent. Say it like you mean it as well. Request a speech referral from your neuromovement disorder specialist if you have any of the concerns, or if you're a 3 or over on that EAT-10 screener that we completed. Complete aggressive daily oral care, hydrate well, monitor your weight, exercise daily, and then participate in a Parkinson-specific treatment method, such as Speak Out or LSVT. Make sure that you are in touch with a speech language pathologist so that you can get the appropriate care that you would need and care for that larynx and your body over time. So that is all I have for you guys today. Just remember, clean mouths and swallow with intent.
Erica, thank you so much for that presentation. We really appreciate your expertise and really just taking the time to speak with our community today. So thank you so much for that.
Of course.
And everyone, we will be taking a 10-minute break right now. So just give me one moment here. So we'll be taking a 10-minute break. During this break, I will show you 2 videos. So one is about PD generation, that slide I talked about earlier. Just a little info about that if you're interested. Another is one called the Topaz study. So 2 research programs that we're involved in, a lot of great information. And also I just want to let you know this. So everything that we talk about today, including a recording of this program and the slides, will be provided to all the attendees today in a follow-up email that comes about a week after our program. So I just want to let you know that. So everything we talk about, resources, etc., those will be shared with you in about a week. So we will resume in about 10 minutes here. So it's 12:14 Central, about 12:24. Central Time, and everyone get up and stretch your legs, get a little bit of a break, and we'll see you soon.
Join the PD generation to help map the future of Parkinson's disease. PD generation, Mapping the Future of Parkinson's Disease, is a Parkinson's Foundation initiative that offers genetic testing and genetic counseling at no cost for people diagnosed with Parkinson's disease. Genetic testing can be a powerful tool to uncover key molecular mechanisms that cause Parkinson's, which can lead to improved treatments and care. Participating in PD generation gives you the opportunity to better manage your disease in the future, help scientists advance their understanding of Parkinson's disease, improve Parkinson's care and research, accelerate enrollment in clinical trials, help develop Parkinson's treatments and personalized medicine. The Parkinson's Foundation cares about the health and safety of our participants, which is why we offer participation in PD generation from the comfort of your home. If you have a confirmed diagnosis of Parkinson's, get started on your virtual PD generation enrollment at parkinson.org/PD generation to check your eligibility status with our short pre-screening questionnaire. Contact any participating site before your telephone screening appointment. Please watch a pre-counseling video on the Parkinson's Foundation website. Then, as part of your telephone screening appointment, you will provide e-consent, and we will schedule your virtual testing appointment. Before your testing appointment, you will receive your at-home genetic testing kit in the mail. Leave your kit closed and stored in a safe place until the day of your testing appointment. During your virtual testing appointment, a healthcare provider will show you how to use your at-home kit. Consider having a loved one join you during this appointment to possibly help with sample collection. That's it. Once you've collected your cheek swab sample using the at-home kit, use the prepaid shipping label to return your testing sample for safe storage and analysis. Before the visit is over, you will schedule a follow-up appointment with a genetic counselor to discuss your test results. Within 6 weeks, you will receive a phone call from a genetic counselor to review and help you interpret your genetic test results. After reviewing your results with the genetic counselor, you will be asked to complete an online survey about your PD generation experience. Commit to helping us advance Parkinson's research today. Enroll now to be part of PD generation at parkinson.org/PD generation. You can also call the Parkinson's Foundation helpline at 1-800-4PD-INFO 473-4636 to speak with a helpline specialist in either English or Spanish. Help us change the course of Parkinson's and sign up today.
Thank you for your interest in the DuPage study. Did you know that people living with Parkinson's disease have a higher risk of breaking bones, including a 4 times higher risk of hip fracture? Led by experts in bone health and Parkinson's disease at UCSF and Sutter Health, DuPage is a trial of Parkinson's and zoledronic acid, an exciting study that hopes to learn if a drug that's currently approved to treat osteoporosis may also reduce the risk of fractures for people with Parkinson's disease and Parkinsonism. We are currently seeking people to participate in the DuPage study. You can join the study if you're 65 years of age or older, have Parkinson's disease or Parkinsonism, and you have not experienced a hip fracture. You don't even have to leave your home to be part of the study. You can enroll online and receive a study kit by mail. Some participants may meet with a neurologist by video, and all participants will have a one-time visit with a research nurse at their home. Then you can check in with the study in the following years by email or phone. As a participant in DuPage, you will be randomly assigned to a study group. which means you will either receive a one-time dose of zoledronic acid or you'll be in a group that receives a one-time dose of a placebo. About 10% of people who take zoledronic acid have mild flu-like symptoms, but this is a rare side effect. As a thank you for your participation in the study, you'll receive $100 upon enrollment and $50 for each year of the study after that. Together, we can improve the experience of people living with Parkinson's disease and Parkinsonism by finding new ways to reduce the risks associated with this diagnosis. Will you join us?
Hello, everyone, and welcome back. Before we move on to our next speaker, I'd love to thank the generous sponsors of today's program: Lundbeck, Kiowa Kirin, Synovian, Supernus, Accorda, UCB, and Amneal. Their support helps us keep today's program and others free and available to all. For more about these companies and the resource they offer the PD community, including detailed product information, please visit our virtual exhibit hall located here at www.parkinson.org/Greater Illinois/chapter supporters. When you visit this page, all you need to do is click on the sponsor's logo to learn more. And now it is my pleasure to introduce our final speaker, Dr. Kalea Colletta. Dr. Colletta is an attending neurologist practicing at Hines VA Hospital just outside of Chicago, Illinois, and an assistant professor of neurology at Loyola University Medical Center. She is also the director of the National VA Parkinson's Disease and Movement Disorders Consortium Centers at Hines VA and co-chair of the Movement Disorders section at Hines VA. Dr. Colletta completed both her neurology residency and fellowship at Loyola University Medical Center in Maywood, Illinois. In addition, Dr. Colletta is actively involved in research on Parkinson's disease and other movement disorders, especially with regard to exercise and complementary therapies. Thank you so much for joining us today, Dr. Colletta. We really appreciate it.
Thank you so much for that introduction, Jessica. I truly appreciate it, and I'm really glad to be here with you all today. So let's dive right in. Let me pull my presentation up. All right. I hope you're all doing well today. And as Jessica mentioned, I am a movement disorder neurologist at Hines VA just outside Chicago. And I'm also pleased to announce that the VA has partnered with the Parkinson's Disease Foundation, so we're very happy about that partnership. All right, so let's dive right in. I have no disclosures for today's program. Let's see what's on the menu for today. So let's start with an introduction, and then we'll move on to the effect of Parkinson's on digestion and absorption, then move on to diet and Parkinson's disease, as constipation and orthostatic hypotension, and nutritional studies with regards to diets and supplements. And then we'll finish with some recommendations as to what you can do at home to help things. All right, so in general, what can a healthy diet do for us? Now, we all know that we all should be eating a healthy diet, and why? Because it can improve your health and your overall well-being, provides the necessary nutrients you need to carry out your daily activities, also helps you maintain a healthy weight as well. And we know that in Parkinson's disease, there can be a lot of weight fluctuations, which I'll dive into in a little bit here. And in addition, a diet can actually help to improve some of the symptoms of Parkinson's disease as well. So we'll be talking a little bit about that today. Interaction of protein, especially with some of our Parkinson's disease medications. And in general, a healthy diet will better overall, regardless of the type of diet that you're eating. So let's talk a little bit about the digestive system and how Parkinson's disease affects that. So we know that Parkinson's has different effects, right? So it can affect your salivary glands. And Erica Fenton did a wonderful talk on how swallowing is affected in Parkinson's disease. But not only that, but it can affect many, many aspects of your digestive system. One of the most common being decreased gut motility. And basically that's just a decreased transit time of the food to migrate through your gut. And that can lead to constipation and other issues as well. So we kind of accommodate for that and help these things along. In addition, I want to talk a little bit about changes over time in relation to Parkinson's disease. So if we look at this graph here, you can see that there's body weight on this axis, as well as kind of the span of the disease of Parkinson's disease. So I want to focus right here. So this is where we have the onset of disease. And here's our clinical diagnosis. So you know there's usually a delay between the onset and the time that we actually get a formal clinical diagnosis from a movement disorder specialist or neurologist. Well, between that time, the weight actually starts to decrease. And why? It's because you're not feeling as well, right? You're more stiff and rigid. Your tremor comes out. So you're actually expending more energy with this rigidity and this tremor. You're not eating as much. And maybe also your sense of smell and taste is changing. So in this period, we're seeing that there's a little bit of decreased weight over time. Now, once we establish that clinical diagnosis, we could see that there's actually an increase in the weight. And why is that? It's because we start treating you, right? So you're feeling a little bit better. You're probably eating more. Maybe your swallowing has improved. You're doing speech and swallow therapy, as Erica had mentioned. And also, these medications are helping to control that rigidity and tremor, which has actually decreased your energy expenditure. And now you're probably exercising a little bit more. Maybe you're gaining some muscle mass as well. So over time, we're seeing that there's a little bit of an increase, an improvement in healthy weight. And then as the disease progresses, we kind of start to see that the weight kind of decreases again. And that's because we start to have a little bit more in the way of motion. Dyskinesias may start to appear, maybe the tremor reappears, and maybe you're not eating as much because swallowing becomes a little bit more difficult over time. So you can see that there's a very situation in how Parkinson's disease affects weight and even your diet over time. So let's take a look at diet disease. So one of the first things that I want to mention right out off the bat is protein. So we all know that protein and levodopa have kind of an adverse relationship. So basically they're absorbed via the same transporter. And because of that, protein can sometimes interfere with the absorption of carbidopa levodopa or Sinemet. So sometimes it may actually cause a decrease in effectiveness of that medication. So we want to make sure that we mitigate that effect, right? And sometimes you might not notice the difference, but once you dive in, it may be causing more problems than you think. So how can we overcome this? So the best thing to do is consider altering when you take medications in relation to what you eat. Now, the general rule of thumb with anybody that's on carbidopa, levodopa, or Sinemet is to take your medication 30 to 60 minutes before you eat, 1 to 2 hours after you eat. That way you kind of prevent that interference, that potential interference with protein. And I know, carbidopa, levodopa, we know can cause a lot of nausea and some GI discomfort. If that happens, you can take your pill with carbs as opposed to protein. So just something to just keep in mind. But one of the really interesting things is that there was a study that looked at a protein redistributed diet. And what this study suggested was that you typically want to eat your main bulk of your protein in the evening. And why is that? Well, we start to think about how our day goes, right? And in the beginning of the day, we want to be our best. We want to be on, right? So less tremor, less stiffness, less rigidity, better walking. Well, at that time of the day, they're recommending maybe trying a little bit of lower protein during the meat of the day. And then at the end of the day, that's when you eat your higher protein meals, because by that time, you're probably going to be going to bed. You're not going to need all that energy and that really great control of your Parkinson's disease. And what this study showed is that those that did do this protein redistributed diet with low daytime protein, where they ate more bread, pasta, and low protein, and a high evening load of protein, they showed that there was a statistically significant reduction in off time, which is huge. So if you could just get a significant reduction in your off time just by kind of changing the way you eat your protein and at what times of the day, you can maybe feel better throughout the day. So I thought that was a very interesting study. Now, one of the major issues we know about in Parkinson's disease is constipation. And one of the theories is that Parkinson's does start in the gut. So we know that there's this abnormal protein that aggregates, and it's called alpha-synuclein. And we believe that it actually starts in the gut. And that's where we think that constipation comes from. And that is why 70 to 80% of Parkinson's disease patients typically have issues with constipation, which can cause all kinds of issues, hemorrhoids, impaction, and it's just uncomfortable. So how can we accommodate for that? So one of the best things that you could do is drink lots of water. And for Parkinson's disease patients, if you continue to maintain a great level of hydration. And that means at least 48 to 64 ounces per day of water, or just 3 to 5 bottles of water. So those 16.9 Ice Mountain bottles, 3 to 5 of those a day, and that will greatly help you. In addition, exercise. As Jessica mentioned, that is one of my main areas of interest with regards to Parkinson's disease. That can actually help your gut motility as well. Water and exercise and constipation should be a little bit better. In addition, increase that fiber intake, increase that bulk. So 30 to 40 grams a day of fiber is really what can help kind of make that constipation. Increase whole grains, bran, fruits, vegetables, leafy greens, get into a routine And of course, there's a lot of over-the-counter medications, Docusate, Senna, Miralax, psyllium fiber, and we can provide you with those as well. But those are just some of the things. But mainly, drink that water, exercise, increase your fiber intake, and if you need to, we have some medications to help that out as well. Also, there is a constipation recipe here that might be helpful for some of you. So you had a cup of crushed 100% bran flakes, or like a fiber cereal. You mix that with 1.5 cups of canned pears. You can blend that together and eat at least a tablespoon a day or more, depending on what you need. So it's kind of like a healthy snack that you can do to kind of help out with that constipation. Next, orthostatic hypotension. So first of all, what is orthostatic hypotension? That basically is when you stand up, your blood pressure tends to drop. And we know that in Parkinson's disease, it's a factor of the disease, but it's also related to the medication. So carbidopa-levodopa can actually cause you to have a higher propensity for orthostatic hypotension as well. So you got two things kind of fighting against you there. But how can we make sure that we mitigate this as well? One of the things is to avoid large meals. So what happens with a large meal is all that blood goes into your gut because it wants to digest all of this food that was just put in there. So it's not in your main core circulation, your heart and your out the day. That can really help to kind of prevent you from having these after a large meal. Eat some smaller meals throughout the day. In addition, I know I mentioned it before and you'll hear me mention it again, drink more water. Water, definitely, we said 48 to 64 ounces of water per day, 3 to 5 bottles potentially. And one thing that can actually help is if you drink maybe 2 glasses before you get out of bed in the morning. Make sure you're sitting up, obviously, but drink 2 glasses before you get out of bed. When you make that first initial stand up from laying down, your blood pressure will hopefully not drop as much. In addition, other things to help prevent, all of our blood kind of goes out to our extremities and our hands and our fingers. So it's not, again, in that central circulation. So avoid really hot showers. Hot showers are okay, but not too hot. So always be wary of having a little bit of lightheadedness or dizziness when you're showering. In addition, you can increase the amount of salt in your diet in moderation if this is a big problem for you, and like I said, in moderation though, and also reduce your alcohol consumption. You can even sit up with the head of the bed a little bit and just make sure that you're standing slowly. Don't impulsively stand up too quick because that's when this do not work. We have some things that can help you out. So compression stockings, typically thigh-high compression stockings, they're a little bit tight. They may be a little bit uncomfortable, but they can really help to keep that circulation, that blood volume where it needs to be, as well as abdominal binders. Same thing, that helps to keep that blood volume where you want it. And if this is a severe problem, because we know that it can actually lead to passing out. We do not want you passing out, hitting your head. If this is a severe problem, please talk to your doctor because you may need some medications for that, on that order of midodrine or Florinep nature. So if it's becoming a big problem, try all these measures that we mentioned, but also talk to us if you need any more help with that. So let's move on to diet. So a couple diets have been studied in regards to Parkinson's. They're both kind of linked to each other, and one of them is the Mediterranean diet. So basically this is a plant-based, more than meat-based, but red meat is you can still eat it, just in moderation and limit your red meat intake. And this is a diet that's high in vegetables, olive oil, fish, fruits, whole grains, beans, nuts. And really, when it comes to the fish, you want fatty fish because they have a little omega-3s in them. And omega-3s are good for your overall health, as well as your cognition. We'll talk about it a little bit later as well. But so that would be lake trout, salmon, tuna. So if you like your fish, go with these types of fish. They're a little bit more healthy for you and a little bit more beneficial. And then red wine in moderation. And in terms of what the Mediterranean diet can do for Parkinson's disease, there were some studies that suggested that it may delay the onset and even potentially slow the progression. Now, there's a little bit of a disclaimer here because, some of the patients that
Dr. Colletta,
that tend to adhere to the diets in general.
Dr.
So,
Colletta, Sorry, Dr. Colletta, I hate to interrupt you. You know what? We're going to just take a break just for a second because there's just some technical difficulties with some phrasing, and this information is so important. And I know that our attendees want to make sure that they hear very
Thank
clearly.
you so much.
So everyone, just give us a moment. We're going to launch a poll, and then we're going to have you guys answer that. And Dr. Colletta, we're going to get you on over the phone. Okay.
Thank you so much, Jessica. Sorry about that.
No, please, no apologies. Okay, everyone, we see that you're answering this poll. We're just going to get Dr. Colletta over the phone.
Okay, Dr. Colletta, unmute your phone right now, and so we could check if there's any echoes going on.
Thank you, everyone, for your patience. This is our virtual world, right? It happens once in a while. So, okay, so here's our poll. It says, what are some ways you are staying active during these times? And our choices were yoga, boxing, walking, housework / yard work, and other. So a majority of people answered 67% with walking, followed by housework, yard work. Although I'm not sure where you guys are located, but here in Illinois, it's getting a little chillier. So that yard work, aside from the leaf raking, is slowing down a little bit. And then followed by yoga and boxing, or actually other, and then yoga and boxing are tied. So just give us a moment, guys, here, and I'm going to share the slides.
Hi, everyone. Can you hear me?
We can hear you, Doctor. So we'll just, so you can still continue sharing your slides unless it starts freezing again, then I'll completely take over that, okay?
Sounds great. Sorry about that, guys. I apologize for the inconvenience.
No worries.
All right. So just talking about the Mediterranean diet, basically some studies suggest that the Mediterranean diet can actually slow the onset or even slow the progression of Parkinson's disease. But with this, there's always a disclaimer, and the disclaimer being that some of the people that tend to adhere more to these types of diets have a healthier lifestyle in general. So they're doing a little bit more in terms of exercising more, drinking less caffeine, increasing their vitamin and supplement intake, and smoking less. So you always have to take these with a grain of salt. But in addition, it can also help reduce the risk of or improve blood pressure, cholesterol issues, and heart disease as well. So there's some other benefits to the Mediterranean diet to be aware of. The next diet that I would like to talk about is the MIND diet. And the MIND diet, and I think, Jessica, I'm having a little issue advancing the slides.
Okay, so I will
Sorry.
That's okay.
Actually,
I'm going to start advancing it for you. So just hold on one moment.
thank you so much.
You are welcome. Let me just get to, is this where we are?
Yes, that is perfect. We're actually on the next one, which would be the MIND diet. Perfect.
Yeah.
Thank you so much. All right, so in terms of the MIND diet, this is a combination diet, and it's a combination of the Mediterranean diet that we had just talked about, plus the DASH diet, which is was more for kind of high blood pressure. So it's the Mediterranean DASH diet intervention for neurodegenerative delay. Now, this has mainly been studied in Alzheimer's disease, and it actually has shown that it lowers the risk of Alzheimer's disease, as well as slow the rate of cognitive decline. Now, we know, too, that unfortunately in Parkinson's, there are some patients that will have some cognitive decline over time. So as you can imagine, this diet would be very helpful for in other ways as well. But what about its effects on Parkinson's disease with regards to the studies that have been done? And there was a study by Agarwal in 2018 where it showed that higher MIND diet adherence led to a decreased risk of developing Parkinson's disease and a slower rate of progression. And they actually broke it down and showed that each unit increase in adherence to the MIND diet actually led to a 13% reduction in the rate of developing Parkinson's disease. So I think that that's pretty significant. So I typically recommend the MIND diet. I think it has good implications for both Parkinson's as well as the cognitive aspects of Parkinson's disease as well. All right, next. And what is on the MIND diet? So the MIND diet is encompassed in this slide, where we see that in terms of vegetables, you want to eat at least 6 servings or more a week: kale, spinach, greens, salads. In addition, with berries, you want to have that about 2 times a week. So strawberries, blueberries, anything of that nature. Nuts, you want to have greater than or equal to 5 servings of that a week, and you can have a variety of nuts as well. You want to make sure that your main cooking oil is olive oil, not vegetable oil or anything of that nature. Try to cook mainly with olive oil. In addition, we have increased your intake of whole grains to about 3 or more servings a week. So your oatmeal, quinoa, whole wheat pasta, those are all great things. And again, we're going to talk about fish a little bit. So fish, we want to have that at least once per week. And again, we want those ones that are high in the omega-3s, those fatty fishes, the salmon, the trout, the tuna. And also increase your intake of beans to about 4, have it with 4 meals per week. And poultry, you can have it about 2 or more times a week. So chicken and turkey, but you do not want it to be fried. That kind of negates the healthy benefits of it. And in terms of wine, we do recommend a glass or less per day. And red wine has been studied a little bit more because red wine has resveratrol in it, which is a compound that is shown to be helpful in Parkinson's and other disorders as well, and just general overall health. So that's what's on the MIND diet, but what should you avoid? Next, please. So we need to limit our intake of butter and margarine to about less than a tablespoon a day. Also, limit the amount of cheese to less than 1 time per week. I know that sounds kind of restrictive. And in terms of red meat, you want to have less than 3 servings a week of red meat. So you can have your red meat, just again, in moderation and a little bit more limited than maybe what you're doing currently. Fried food, less than 1 time a week. Try to cut that one down a lot. And in terms of pastries and sweets, less than 4 times a week. I'm sorry to mention pastries and sweets, but it is just less than 4 times a week. So not too bad, right? But these are just the things that you kind of want to do in more moderation and kind of increase the intake of the foods you mentioned on the slides before, your whole grains, fishes, nuts, and olive oils. Next. So breaking it down into dietary components, what do we have here? Next. All right, so tobacco and nicotine. I just want to start with a disclaimer. I am in no way advocating anybody start smoking. It is not good for your health, unfortunately, and overall the risks outweigh the benefits in great number. But I do want to talk about it a little bit because nicotine actually scavenges free radicals. And what we have seen is that the risk of Parkinson's disease is lower in smokers, and not just any smokers, but those that have actually smoked for a longer period of time. So the longer you smoke, the lower your risk of Parkinson's disease. However, there is no evidence that suggests that smoking slows the progression of already established disease either. And like I said, not advocating for taking up smoking, but how can we get that benefit? Can we harness that benefit in a different way? And maybe can we harness it through our diet? And the answer is yes, maybe we can. And we have seen that a couple foods that are inherent to the Mediterranean and the MIND diet do have similar antioxidant and free radical scavenging properties as nicotine. And that would include eggplant, peppers, tomatoes, and potatoes. So we can actually get that benefit in another way. Next. And one of the other things that has been shown to be helpful for reducing the risk of Parkinson's disease was coffee and caffeine. So multiple studies have actually showed there's this association between caffeine intake and just a reduced risk of Parkinson's disease. And why is that? Well, it has a compound in it called EHT, which is related to serotonin. We know that there is some serotonin dysfunction in Parkinson's disease as well. And in studies in mice, it is shown to reduce the disease-causing ability of that abnormal protein we talked about, that alpha-synuclein protein that we believe causes Parkinson's disease. That's one of the ways. Now, the other thing is that coffee can actually help to mitigate the symptoms of Parkinson's disease as well. And the way in which it does that is that it's an adenosine A2 receptor antagonist. And actually, that's the same mechanism of action as one of the drugs that are currently on the market, which is istradefylline or Nurians. And this has the potential to reduce off periods. Now, disclaimer again, we don't want to drink too much caffeine in coffee because it's very dehydrating. So again, that hydration is so important. And if you drink too much coffee and caffeine that's a little bit dehydrating, you also may have a higher risk of orthostatic hypotension, which we were talking about before. So you can definitely drink coffee, just make sure that you're replacing it with water as well. So if you drink a cup of coffee, drink a cup of water with it as well. These are things that can help, but we do know that coffee can help reduce the risk and as well as mitigate some of the symptoms of Parkinson's disease. Next. Alcohol, as we talked about in terms of the Vine and Mediterranean diets, we do recommend that you drink a glass or less of red wine a day. And it's not harmful per se. Like we said, in moderation is okay. You obviously don't want to overdo it, but it could cause a higher risk of falling. And you may have a little issue tolerating it. So I would say, try to cut back on that if it's something that you enjoy. Maybe a drink a night, as we mentioned, wine being, one of the better ones for you. And it may interact with some of your medications. And we know, especially those of you that are on dopamine agonists, such as pramipexole or ropinirole, you can actually have a higher propensity to have a little bit more addiction risk. So just be careful with those. But like I said, everything in moderation, basically. Next. In terms of dairy, there's been some studies to suggest that potentially you want to cut down and kind of have a limited amount of dairy in your diet. And that's because there was shown that there's a mildly increased risk of Parkinson's disease in those that reported the highest consumption of milk. And potentially, they mentioned that there's maybe a little bit more of an increased risk with milk and cheese, not as much with yogurt and butter. But again, with dairy, I would just say in moderation. And you can get vitamin D and calcium from other sources as well. Next, please. And in terms of cannabis, I just want to be very quick on this one. We get this question a lot of times, and there's just unfortunately not enough data on it. There's been several studies that have really not shown benefit, and some of them have just had some issues with the way the studies were carried out. So really, the data is not very robust here. And this does have a risk of psychosis and hallucinations with it. I just personally think that there needs to be more controlled studies done on this so we can actually see what it's doing. So that's just a quick word on cannabis. But like I said, we need a couple more studies to kind of see what really the effects are and how beneficial or not it can be. Next. And now let's move on to supplements. So our first slide is just mentioning how the Food and Drug Administration doesn't really regulate supplements. It's not as regulated as the medications that we prescribe in clinic. It doesn't have to undergo that rigorous testing, and there's not a lot of quality control for a lot of these things as well. So that's just a disclaimer to kind of let you know that, these aren't as regulated as the medications we're giving, but that's not to say that we shouldn't try them. Basically, some of them have been shown to be helpful, and we're going to dive into some of the studies on these different supplements and how they can affect Parkinson's disease. Next. So in terms of vitamins and supplements, CoQ10 has been one of the more studied of the supplements. And early on, it showed some promise. Over time, more and more studies were done, and unfortunately, it didn't really show that robust benefit that we were hoping for. Basically, it didn't really show much in a double-blind placebo-controlled trial, which is our gold standard of studies. But it was safe and well tolerated, and there is some benefit in other diseases as well for your cardiovascular health and with statins. So I think it's worth it to try, but in terms of its benefit in Parkinson's disease, jury's still out. There are still studies going on with it, but nothing, like I said, so far that's that robust. In terms of fish oil, basically it's an antioxidant. It reduces inflammation. We know that inflammation is an issue in Parkinson's disease. So it does kind of get to some of the pathophysiology of our Parkinson's pathogenesis. And we saw that in a study in 2008, they studied the effects of fish oil on depression in Parkinson's disease. So as we know, Parkinson's disease is not just our motor symptoms. It's not just the tremor, the rigidity. It's also these non-motor symptoms, the anxiety, the depression, the swallowing difficulties, all these other things that come with it, the orthostatic hypotension. So fish oil has been studied with regards to depression in Parkinson's, and actually there was some statistically significant improvements in some scales of depression and Parkinson's disease. There were not, unfortunately, any studies that were, in regards to motor symptoms of Parkinson's, so your rigidity and tremor. But like I said, if we can help some of the non-motor features, such as depression, maybe we can do some good there. Next. So there was also a study that was looking at a combination of omega-3 fatty acids and vitamin E. Now, vitamin E was studied by itself in Parkinson's disease in several studies, and unfortunately, it didn't really show any benefit. However, in this study in 2017, and this was a randomized, double-blind, placebo control, which is, again, our gold standard studies, they studied the co-supplementation of omega-3s and vitamin E. And what they did was they had patients take 1,000 milligrams of omega-3 fatty acids and 400 international units of vitamin E for 12 weeks, and then they gave the other patient populations the placebos. And what they found was that the group that had the omega-3s and the vitamin E actually had significant improvements in their UPDRS. And the UPDRS is that Unified Parkinson's Disease Rating Scale that I'm sure you're familiar with as your neurologist, have you doing finger tapping in clinic and all of that. So that actually is really showing that there's a good motor benefit with these two supplements in combination. In addition, again, decreases inflammation, which we know is part and parcel of Parkinson's, and it increases levels of a compound called glutathione. Now, glutathione, we know and we've seen that Parkinson's actually, there's a kind of decreased level of glutathione in the substantia nigra, and that's where Parkinson's originates from. So this is interesting because if we can increase glutathione this way, that would be something beneficial. And in our next slide, we're going to see a little bit more about glutathione. So next. So basically, it's a powerful antioxidant, and it's involved in nerve cell metabolism. And like I mentioned, it's actually depleted in the substantia nigra, which is exactly where Parkinson's originates from. However, there's been a lot of studies on this. We just can't quite figure out how to harness that power quite yet. The studies have been kind of mixed, a little bit poorly controlled, so more studies need to be done on this specific compound. There's also been studies done on its precursor, N-acetylcysteine, which is in our next slide. And N-acetylcysteine, like I said, is a precursor to glutathione. So there's a drug on the market called Mucomyst, and we typically use this for respiratory issues, but it actually does have implications in Parkinson's disease. And as I mentioned, because it's a precursor to glutathione, that's where we're seeing some of this potential benefit. There was a small study in 2019 that showed that there were some improvements in both motor and cognitive symptoms in Parkinson's disease with N-acetylcysteine. There was a new trial that has been done this year, as a matter of fact, but it hasn't been completed yet. So we don't have those results, unfortunately. I wish I could tell you some good news, but they were testing whether N-acetylcysteine reduces the production of reactive oxygen species in the cerebrospinal fluid. So hopefully this is a good study for us, and we'll keep monitoring, what N-acetylcysteine and glutathione, what role they can play in potentially helping to mitigate Parkinson's symptoms. So again, some promise, but we need some more studies on it. Next. Inosine, this one was actually studied pretty thoroughly. There was a whole trial on it, randomized, placebo-controlled. And basically what we saw was that urate is actually a natural antioxidant, and higher levels were associated with less Parkinson's risk. And basically inosine they thought could slow the disease progression. And unfortunately, the study was terminated because it didn't really show any benefit. So unfortunately, that one really hasn't taken off. There was some promise there, but hasn't really shown any promise. Next. In terms of probiotics, so probiotics, these are foods and the supplements that have these kind of gut flora and bacteria that is just meant to support that good flora, that good gut flora that's in your stomach. And basically, it can help with constipation or diarrhea. There's nothing, in terms of studies that have been really linked to Parkinson's disease, but if it can help with constipation. It can also help restore the flora after you've taken antibiotics. There is a little bit of a risk is that potentially it could cause infection if you have an impaired immune system. So be careful with this, but potentially could be helpful for at least constipation. Next. In terms of vitamin D, so vitamin D deficiency has been actually associated with an increased risk of Parkinson's disease. So when we studied vitamin D, we saw that there was no motor benefit seen with vitamin D supplementation. However, we do know that unfortunately with the gait and balance difficulties that we see in Parkinson's, falling is a big risk. And basically vitamin D can help to prevent fractures and has a little bit of a lower risk of fractures. So I typically recommend that all my patients go on vitamin D supplementation just for that fact, just for safety, just in case, to kind of reduce that fracture risk over time. And basically, what can you do to increase your vitamin D? You can sit out in the sun a little bit. Milk products, cereals, fatty fish, again, and eggs, all are good sources of vitamin D. And the current recommendation is to have 600 international units per day in those that are about 50 to 70 years of age, and 800 international units daily in those that are over 70. So like I said, I would always recommend vitamin D supplementation given fracture risk. Next. Melatonin. So melatonin is a compound that's released by your brain, your own brain, that helps you sleep, and it kind of prepares you for sleep. So it gets you in that kind of circadian rhythm. And we have shown that there's been some studies to suggest that can also help with REM behavior disorder. And I know that some of you probably are dealing with this right now, unfortunately, but REM behavior disorder is basically a condition where you have these vivid, aggressive nightmares and these dreams that are very real, and you end up acting them out. So you start kicking and punching at night. There's been some studies to suggest that melatonin has a potential to be beneficial in that. So that's another good reason to potentially start melatonin in addition to insomnia. So it's kind of good to kind of reset those sleep patterns and help with that insomnia and potentially the REM behavior disorder. Next. And vitamin B12. So vitamin B12 is just good for your overall nerve health. And basically it can also help with memory. So this is something that we always check because vitamin B12 deficiencies have been associated with some cognitive issues, as well as has been seen in Parkinson's patients as well. So B12 is just a good natural supplement to help your nerves. And it's actually found in animal protein sources. So meat, eggs, fish, even dairy products can be very high in B12. If you're a vegetarian, I would definitely recommend B12 supplementations because you're not getting it from the meat. So I would definitely, and anyone I recommend it, but especially those that are vegetarian. And like I said, usually we want to do like 1,000 micrograms a day or so. That can help with your overall nerve health. Next. And others. So Mucuna pruriens, this is actually a compound. It's a very natural compound that contains levodopa. The problem with it is there's no carbidopa. So what happens because there's no carbidopa is it increases the risk of side effects. And I've heard a lot of nausea and vomiting. I've had some patients that have tried it. Side effects have been a little bit high. And again, it's not really regulated in terms of the amounts. So, there's some compounds that are very high in it, some that are very low. So you want to be very cautious with this one. It has promise, again, because it does have levodopa in it, but there's not enough, things to control that nausea and to kind of make sure that these amounts are a little bit more regulated. Next. And the other is curcumin or turmeric. So this actually is great. It's a potent anti-inflammatory, and we don't really have any direct studies in humans in Parkinson's. We did see that in a fly model of Parkinson's. There was less oxidative stress, better locomotion, and less neurodegeneration. So it has potential to be effective. And like I said, inflammation is a big thing in Parkinson's disease. So I would advocate for potentially trying turmeric just for the anti-inflammatory and properties and the potential to maybe improve some Parkinson's studies. We do need some more studies in humans, however, but if that's shown in a fly model, I'm hoping that maybe that has implications for us as well. Next. And what can you do? So here are my kind of quick and dirty recommendations from today's talk. So first off, drink more water. Basically, you want to drink, again, at least 48 to 64 ounces a day. That would be 3 to 5 of those 16.9 ounce bottles that you can get at the store. In general, overall healthy diet, right? So low in salt, low in fat, don't eat too many processed or fried foods. And I would recommend trying to adhere to the MIND diet or the Mediterranean diet. Increase those fish, the whole grains, olive oil, beans. Try to adhere to one of those diets as they have been shown to have some benefit in Parkinson's with a few studies. Also, you can try that low protein redistributed diet where you do a little bit more low protein during the meat and bulk of the day and your higher protein meals at night to prevent that interaction with carbidopa, levodopa. In terms of supplements, unfortunately, nothing has shown to either slow the progression or prevent the appearance of Parkinson's disease, unfortunately. However, there are some definite ones that can help you with your overall health, such as vitamin D in kind of decreasing your fall risk, vitamin B12 for your overall nerve health, melatonin for sleep, and potentially REM behavior disorder as well. And also consider the omega-3 fatty acids, and maybe even the omega-3 fatty acids in combination with vitamin E that we talked about earlier. And exercise, exercise, exercise. If you don't move it, you lose it, especially in Parkinson's disease. So I think that, exercise is always one of the best things that you could possibly do for your health. And also socialize, get out there, enjoy yourself. But I think these are a good list of recommendations to take away from this talk. And I hope you all enjoyed it. And if you have any questions, we'll be here to answer. Thank you all so much.
Thank you so much, Dr. Colletta. Oh my gosh, great presentation. We greatly appreciate it. And we are going to, so I just want to tell our attendees, we're still doing our 15-minute Q&A. We are a little bit behind today. So we'll go about till about 1:20 Central Time. If you're able to stay on with us, wonderful. If you're not, like I said, this will be recorded, but we have a lot of great questions that we'd like to get you. So answer for you guys. So just give me a moment while I access my questions here. All righty. Erica, is there a goal to drink enough water and stay hydrated and to help with swallowing to avoid dehydration? How many cups of water should a person drink a day?
So in the speech pathology world, it's pretty consistent with what Dr. Colletta said as well. We say 64 ounces. If that changes for like specific medical needs of the patient, you would want to consult your physician. Another benchmark that we use is half your body weight in ounces of water. So most people weigh, around 120 pounds or so. So you take or leave a little bit of that. But the more we swallow, the better we're going to access those muscles and keep them strong. It's basically a form of exercise, right? The more we exercise, the stronger we are. So when you're drinking your water, make sure you set out that amount to try to get 64 ounces within a day. The trick that I always tell my patients, and I live by this too, is get a bottle, know how much is in that bottle, and know how many times you need to refill it in the day, and try to stick to that. And then when you take a drink, swallow hard and fast. So you're going to not only be working on your hydration goals, but you're also going to be maintaining and strengthening those muscles.
Thank you, Erica. I actually personally bought a bottle recently that has it starts off in the morning and it gives like little motivational.
Yes.
At it because I need reminders to drink more water. So I'm sure we all do. Dr. Colletta, this is a great question. It says, are there any considerations with nutrition and PD and how it relates to diabetes, type 1 and type 2?
That's a great question. And there have been some studies with regards to like a ketogenic diet it hasn't really shown much in regards to Parkinson's disease specifically. We know that it can be very helpful in diabetes. And some of the same, rules apply. You want to cut down on your sugar and carb intake and increase your protein intake. But, in terms of kind of, data with regards to kind of a ketogenic diet, there hasn't been much with regards to Parkinson's, but definitely helpful for diabetes. I wish we had a little bit more, but kind of those same rules apply and, drink a lot of water and decrease kind of that carbohydrate and sweet intake. That can help in general too. And exercise.
Yes, exercise, right? And, Dr. Colletta, I'm going to stick with you because this would kind of piggyback on that. So someone had asked about a plant-based diet. Do we have any information about more plant-based diets in Parkinson's? And I know you touched a little bit on the Mediterranean, but.
Yeah, so, there has been a couple studies with regards to that. And really it's been more with like kale, spinach, green leafy vegetables. Those things can really help. And like I said, with any kind of vegetarian diet, you want to be a little bit cautious with the B12 because B12 deficiency can have an impact on Parkinson's disease as well as even neuropathy as well as cognition. So you want to make sure that you're eating a balanced diet. But with the plant-based diets, definitely increase kind of that kale, spinach, those types of things. And like I said, and kind of you can incorporate it into the MIND diet so you kind of have that crossover with some of those other compounds that have been shown to be a little bit more helpful in Parkinson's. But like I said, if you're eating one of those vegetarian green leafy vegetables, always try to make sure that you're getting your B12 supplementation in.
Great, thank you. Erica, so this question is for you, and I just lost it, I apologize. Are there any virtual speech programs out of Central DuPage Hospital? I think you mentioned they're on pause. And this is a two-part question. Are there other specific online programs that you recommend currently?
That is a fantastic question. Thank you for that. And it's a good reminder for me to talk about that. So the programs that we run at CDH are based out of the Speak Out program. And so the Loud Crowd is the associated group with that. Prior to the pandemic, we had a few groups that were running and really consistent with really dedicated patients, and it was just a wonderful maintenance program. We tried to transition over to a virtual environment, but it creates a pretty significant challenge, just in the same way that today we have everyone muted, because otherwise you get a lot of feedback and it's really challenging. We weren't able to really successfully get the amount of exercise and feedback that kind of really is the special sauce that makes those groups so wonderful for patients. So what you can do instead, that we've been really encouraging patients to do during the pandemic, is that the Parkinson Voice Project, which is the creator of the Speak Out program, has a Facebook page. So you don't even have to have, if you don't like social media and you don't want a Facebook account, you don't even have to have a Facebook account. You can access this even without being a Facebook member, but you go to their page and they actually have daily live streams where they go on and they practice the exercises. So they don't have the ability to hear you, but they give really wonderful cues and kind of get you engaged and doing the exercise, which is fantastic. And it can, if you haven't done Speak Out with a speech therapist, it can sort of be a little taste of what the program is like too. I always recommend that you make sure you get the individual treatment component as well, because we don't want anything that's going to strain or, potentially damage the voice. So we want to make sure we're doing it the right way, which is where that one-on-one therapy is so important. So the one-on-one therapy is usually about 12 sessions with a speech therapist, and they train you how to do the program. But the live stream has been a wonderful surrogate for the group that we run, and it's a really fantastic program. I even, if you subscribe to the page, I get like a little reminder on my phone every day. It says like Parkinson Voice Project is live, and you can jump right in. They also record it though, so if you can't catch it at 10 o'clock or when they're doing it, then you can go back in and watch it later. So if you're interested, go to the Parkinson Voice Project page on Facebook, and you can see those live streams there, and it's really, really stellar. The creator of the program, Samantha Ellendary, is the one who actually leads it. So she's stellar, and it's a really fun way to kind of get yourself engaged and continue exercise, even though, we can't do the groups at this time.
Great, thank you for sharing that. Dr. Colletta, please address nutritional help for those with very advanced Parkinson's. I think sometimes with advanced Parkinson's, we need to talk about those things a little bit more and how we can help those individuals.
Absolutely. So, in advanced Parkinson's disease, as we know, swallowing becomes a little bit of a bigger issue. And as we mentioned, like in the beginning, the weight kind of decreases just because as the disease progresses, things change. So in terms of addressing, nutritional needs, at that point, when things are a little bit more advanced, I would actually recommend increasing the protein in your diet just to kind of maintain that body weight and body mass. In addition, make sure that you're supplementing your diet, making sure you're drinking a lot of water. That can be really helpful. Now that can also, have an impact on your swallowing. So you always want to be cautious with the amount that you're eating and drinking. Make sure you're taking, small bites and things of that nature. But I would definitely, at that point in the disease, increase your vitamin and supplement intake, in terms of the vitamin D for fracture risk and fall risk, absolutely. Your vitamin B12. You can even try some of these other supplements like the CoQ10, the omega-3s. All of these things can be helpful in kind of just setting you up well, kind of maintaining that overall health. So that way, you're setting your body up for a little bit more kind of muscle mass and things of that nature. So, unfortunately, it's hard to maintain nutrition. And I know, as the disease progresses, that gastric emptying can become a problem, and you may have more constipation or your appetite may decrease, but trying to maintain that healthy level of eating. And like I said, maybe increasing that protein bulk in your diet and taking more of these supplements may actually be a little bit more beneficial. And just like I said, improving your overall health, increasing the vegetables and fatty fish and things of that nature can just really kind of set you up for a little bit more success in the future. But yeah, it's a great question.
Great, thank you. And doctor, what about those nutritional shakes and things like that? Are those beneficial for those with advanced PD and just getting calories and there's some protein in them?
Absolutely. So those are wonderful for that because it's a nice, easy way to get all of your nutrients and all of your protein in one, drink. And I definitely always advocate for those for my patients. They have a lot of good vitamins and nutrients in them, high protein. So yes, I would definitely advocate for those.
Great, thank you. Erica, can you discuss the difference in GI and speech therapists again and what they do to help swallowing issues?
Yeah, absolutely. So I typically think of this as being like speech therapist is sort of from here up, GI is sort of from here down. So speech therapist is going to look at your oral and pharyngeal swallow, so the mouth and the throat, and GI is going to look at sort of that esophageal, stomach, and gastrointestinal system overall. We work closely together, but the GI doctor will specialize. We don't diagnose anything that's gastroenterology related. So if we have concerns for those things, we would refer you on to the GI doctor. We can provide some strategies, but as far as like treatments and intervention goes, that's always going to be referred over to the doctor to do. And yeah, a speech therapist will work on strengthening and coordinating with the oral and pharyngeal swallow.
Great, thank you. Erica, this is actually for you, and Dr. Colletta, you can also give your answer too, so maybe you can work together on this one. So one of our attendees said, I have always had problems swallowing medication from childhood on. How can I tell if this is part of the Parkinson's?
Really good question. So pill dysphagia is a really common issue for a lot of people, Parkinson's or not. Swallowing a pill can be a little bit challenging because it's a large piece going down a relatively small opening. With pills, I always encourage patients to, if you have any trouble, actually take it with a puree consistency. So something like applesauce, pudding, yogurt, because the weight of that puree is actually going to help to kind of coat and pull the pill down. Water has a tendency to, or any liquid has a tendency to sort of wash right by. And those natural pockets that exist in our anatomy love to then hold on to the pill, and then we're left trying to swallow it down. So I would say first try to see if you can put your pills in something that's more of a puree consistency, see if that helps you. If that's your only concern, and if that's, prior to the Parkinson's, and if taking it with a puree improves it, then, you could probably manage that at home. If you feel like it's increased or gotten any worse, then I would say maybe consider talking to your doctor and seeing if a speech referral would be appropriate. You never want to crush or like cut a medication unless you have permission from the doctor to do so, because, and Dr. Colletta can speak to this, but the absorption can be different. So you always want to clear that stuff with your doctor before you would go to anything like that. I would say try it in the puree first and see if that helps you, but it can be common. Some people just really don't like to take those pills.
Thank you.
I agree wholeheartedly.
Great. Thank you. Dr. Colletta, any changes to absorption of levodopa when comparing animal PRO versus vegetarian sources such as legumes?
That's a very interesting question. And to be honest, I'm not 100% sure of the answer. I think that any protein can interfere with the absorption, whether it be from a plant-based or an animal-based. But like I said, I'm not 100% clear on that, but I would still, if it's any protein from any source, I would still try to avoid it, taking it with your carbidopa, levodopa, and still adhere to that half hour before or hour or two after, just to make sure that it's not going to interfere, just to be on the safe side.
Thank you. Erica, I have Barrett's esophagus. Any recommendations for swallowing?
So I would refer you back to this slide on the presentation about GI strategies, but then I would also just specifically talk to your GI doctor and see what they can recommend for you as well. Those are just sort of general GI strategies, which is what would be considered within my scope of practice. But those things can sort of change over time. So if it's been a while since you've seen your GI, I would just kind of, you can send them a message or, see if it's appropriate to come into the office and see them again. Sometimes this stuff can even be done by telehealth now. So you could maybe stay home and kind of have at least your initial visit. And if they need to do imaging or further assessment, then they could tell you to come on in.
Great, thank you. We'll just do 2 more questions, everyone. Dr. Colletta, what can be done to increase energy besides exercise? Would B12 or other supplements help?
Yeah, so definitely B12 has been studied with regards to energy. Not that robust again, but B12 has been shown to have that kind of energy boosting property. Sometimes some of the medications that we give can give you that little energy boost. Sometimes dopamine agonists in a way can. I like to try to avoid some of those other things like amphetamines, to kind of keep you awake. But natural energy production really comes from your exercise, B12, and even in terms of just eating a healthy diet, all of those things can kind of set you up, for actually increasing your energy and drinking that water throughout the day. So really it's kind of a holistic approach. You increase all of the kind of increasing your healthy factors, in terms of, eating right, drinking your water, exercising, all those things can help to improve your energy in a natural way. And even melatonin, because it kind of regulates your circadian rhythms. If you're not having, if you have insomnia overnight, a lot of times we see that, the insomnia overnight can carry over to the morning, and then you have more daytime sleepiness. And in Parkinson's, you have daytime sleepiness anyway. So if you're kind of regulating your sleep cycles with, good sleep habits as well. So making sure that you turn all the lights off, don't, have your iPad on, any lights coming from those sources. Those things can help kind of improve your sleep pattern. And if you take melatonin, that can also prevent insomnia. And then you start, increasing these other factors, these health factors, such as, like I said, drinking, exercising, and also taking those B12 supplements. I think that can definitely have a big impact on kind of mitigating that loss of energy throughout the day.
Great, thank you. Erica, I'm going to end with you with the last question. What are your recommendations for decreased intake of appetite due to change in taste and smell?
Sure. So you can always work with a dietitian and they can help you really hammer down into some of the details of those things. But some simple things you could do would be like really calorie rich food, making sure what you are eating is really densely nutritious and high in calories. You can include supplements and things like that into your diet, boost, those sorts of options. And a dietitian is really stellar at kind of showing you how to implement those things and incorporate them into different foods and drinks. The other thing you can do, if you really want to like smell your food and you feel like your sense of smell has been altered, you can kind of cover the food and then remove the cover. And sometimes you'll get sort of like a burst of smell, which can really increase appetite. Having you be present when the food is being like cooked and prepared can sometimes help to stimulate appetite too. So those can be some simple tips, but I always say a dietitian is a stellar option if you're looking at how to specifically figure out your caloric needs. Sometimes people ask like, well, what's the difference between speech and dietary? And that's a really good question too. So we look at the anatomy and physiology, the function, and they look at kind of what's going in. So they'll figure out the diet, nutrition, hydration needs specifically for the patient, and then we work on the swallowing component.
Great. Well, thank you guys. That concludes our Q&A segment. And really, I just can't thank both of you enough for your dedication to this community that is near and dear to my heart. And we really appreciate your time and these wonderful presentations today. So thank you both.
Thank you.
Thank you.
Thank you guys. And everyone, that concludes our program. We really are so happy that you spent part of your Saturday with us, and that we really hope that you have a wonderful Thanksgiving and you're able to, socially distance and see your family as safely as you can. And we really hope that all of you stay healthy and safe. So be well, and thank you again for joining us. Bye.